Hello, everyone. Thanks so much for joining our asynchronous intro webinar for Cohort 5 of the Adolescent Champion Model, or ACM for short. We're so excited to have such interest in our programming, and we're excited that your health center is considering joining a cohort of the ACM. This presentation will be recorded so that folks can watch it on their own time, as full viewing of the video is required by each team member that will drive change in your health center as part of the ACM. The purpose of the intro webinar is to describe components of the Adolescent Champion Model, walk you through the recruitment and implementation processes, and also highlight the benefits of participating in the model. We'll also discuss some time-sensitive action items that we'll engage with you in as partners in this work. Okay. The Adolescent Champion Model, or ACM, is an 18-month multifaceted intervention to address a health center's environments, policies, strategies, and practices to ensure that a visit to a health center and all of its many facets are youth-centered. The ACM is facilitated by the ACM Support Team, which you see on the slide, alongside our clinical consultant and in partnership with the University of Michigan's Adolescent Health Initiative. This group is referred to as the ACM Support Team, and we provide support and technical assistance to a cohort of champion health centers as part of the ACM. And we'll let Dr. Chulani go first, and we'll go in a clockwise motion.
Yeah, hello everyone. Thank you for your interest in our next cohort of ACM clinic. I'm Dr. Vinny Chulani. I serve as section chief for adolescent medicine at Phoenix Children's, and I'm clinical consultant to this project.
Awesome. Thanks, Dr. Chulani. We're so fortunate to have him as part of our team. Tracy Pedrati, our Adolescent Health Program Supervisor, was not able to join us today, but thanks to her tremendous leadership, we are in year 5 of replicating this model. Next to Tracy is myself, Viera Thompson. She, her pronouns. I serve as Adolescent Health Program Manager with the firm. And next to me on the picture in the top right is Elizabeth Cazesus, who has graciously stepped in to help us with adolescent health initiatives as she serves as Title X Program Manager at a firm. Mava Cooper also serves as one of our representatives from the University of Michigan. Mava also could not be here today, but we have a recording of her introduction.
Hello, everyone. My name is Mava Cooper. My pronouns are she, her. And I am a program specialist with the Adolescent Health Initiative out of the University of Michigan. And I work with all the other lovely people on this call to make this project happen. Hello, everyone. My name.
So you've probably heard me mention a firm quite a few times during the last few slides. And unless you're a partner of ours or you've worked with us in the past, you're probably wondering what a firm is. We are a nonprofit organization that was founded in 1974, and we've been provided and receiving the Title X grant fund since 1983, which means that we provide comprehensive family planning services to all Arizonans, whether you are a youth, part of the indigenous community, and we also serve other groups who've been systematically excluded from receiving care. As part of our Title X funding, we're able to provide wellness exams, breast and cervical cancer screenings, STI testing and treatment, birth control and contraceptive items, and more. And our Title X program managers, along with Elizabeth, have created and cultivated a very great wide group of 58 health centers across the state who provide services to over 34,000 patients a year. I also wanted to highlight our sexfyi.org website. SexFYI provides unbiased, medically accurate information on contraceptive items. It also houses our health center locator, which directs folks to both Title X health centers and ACM Champion Health Centers. We're also fortunate to have created what's called the Arizona Alliance for Adolescent Health, or the Alliance for short. And it sort of has two purposes. It's our umbrella term for the adolescent health work that we do here at a firm, but it's also our coalition of youth serving professionals who come together to speak about improving access to care, coordination of care, and quality of care. In that image below the Arizona Alliance, you'll see the healthyazyouth.org website, which we're very proud to have published this year. And it houses our resource hub, which is a clearinghouse of resources for parents and caregivers, healthcare clinicians, and youth serving professionals. We've also served as subject matter experts with many local and state organizations. Those include Maricopa County Department of Public Health's Youth Advisory Council, Rising Youth Theater, and the Reproductive Health Access Project. And we're also very excited to publish every month our Teen Health Tuesday newsletter, which serves as a tips, trainings, and tools resource for youth serving professionals.
Thanks, Bear. So whenever I get to the chance to meet with a new cohort, I always sort of emphasize why we do what we do and what really is at the heart of the Adolescent Champion Model. We have to acknowledge that our health systems, how we provide care, our policies and our practices, were not necessarily designed with adolescents in mind. And there are tremendous gaps in how care is delivered to adolescents, which has been widely described in the literature. In terms of access to care, for example, there are limited numbers of health professionals. Care is not always affordable. Care for adolescents is not always visible. We have visible pediatric centers and women's centers, but there's not necessarily clear teen centers where adolescents know they can where they're guaranteed to receive developmentally appropriate and youth-centered care. Transportation challenges, cultural and language barriers are some additional barriers in terms of access to care. There are also gaps in quality of care. Accessing confidential care, for example, can be a challenge for young people. We don't always perform at our best when it comes to our measures for quality performance in adolescents. Take a look at our adolescent well visit rate. We're performing at about 60% of adolescents having had a well visit in the last year, and we can certainly do better. There are gaps in terms of being able to access sexual and reproductive health services. Even when young people are able to access care, the care that they receive is often discoordinated and delivered in silos. So clearly, there's a whole lot of ways that we can improve in how we provide care to young people. So the origin of the Adolescent Champion Model in Arizona really goes back to about 2015. So each state has a Title V Maternal and Child Health Bureau, which designs and determines what their state activities would be. Recognizing that there were gaps in the care of adolescents, ADHS went and solicited input from community members, from partners, and took a look at state and national resources, asking ourselves, how can we provide better care to adolescents and how can we improve the health status of young people in Arizona? And that's really how we landed with the Adolescent Champion Model. The driving question is, what if every health center could become an adolescent-centered environment? And through the Adolescent Champion Model, health centers really have a chance to look inward and to reflect on how they're doing, to critically assess and evaluate how they're doing, and develop for themselves plans for quality improvement and plans to drive change within their organizations. In the last 5 years, we have been very fortunate to work with a large number of Arizona health centers. We have over 20 champion sites that we've worked with in our last four cohorts. We have a good number of federally qualified community health centers, which are actually represented in our cohorts. And these here are some of the partners we've been able to engage in our past work. We've also been very fortunate to demonstrate the impact the program has through our work with our partners and the work that our champion sites have done in their respective clinics. Taking a look at data from our first two cohorts, for example, we found some notable improvement in adolescent involvement and empowerment in the ability to provide nutritional health counseling practices and in their practices towards reproductive and sexual health service delivery for young people. One of the things that you will learn that you get as a result of your participation is a certification as a gold, silver, or bronzite, depending on the number of quality measures your clinic would have achieved at the end of your implementation of the Adolescent Champion Model. In our first cohort, all our practices ended up with gold level certification, which is the highest level of certification that you can achieve. And we have a process for how clinics recertify. And we continue to see our partners continue to do the excellent work and meet certification benchmark through ongoing work with their practices. One of the things that we've been able to do is really feature and highlight the champions that are doing excellent work out there in the community. And some of the changes that our practices have been able to implement in our clinic, for example, we were at champion sites in Cohort 2. We really strive to create an inclusive environment, and we had pride shirts, as you'll see here with our staff. Our partners over at Valleywise, they felt they wanted to make their environment more teen friendly. And they went about and decorated their clinic differently and had this graffiti teen life wall. The kind of changes that health centers have made as a result of their participation in this model was actually evident to patients. This here are some of the comments that you will see from adolescent patients in our Champion Health centers. They were more clear, the atmosphere was better, and it speaks to the welcoming environment, and it really speaks to the opportunity to improve how you care for adolescents in your practice in ways that make a difference to those we care for.
Thanks, Dr. Toronto.
Hello again, it's me, Mava, with the Adolescent Health Initiative. So the Adolescent Health Initiative, or AHI, provides training, technical assistance, and coaching to healthcare providers, health systems, and organizations across the country to improve adolescent-centered care. Our vision is really to transform the healthcare landscape to optimize adolescent and young adult health and well-being. AHI is based out of the University of Michigan's health system, also known as Michigan Medicine, but we work with youth-serving clinical organizations in over 40 states, which you can see on this map on the slide. As I said, we provide technical assistance, coaching, and support these organizations to help them improve their policies, practices, workflows, and environments in order to best meet the needs of their adolescent patients. AHI also puts on a national conference every year, the annual Conference on Adolescent Health, which is meant for an interdisciplinary audience of healthcare providers, health educators, and other youth-serving organizations. We hope that some of you will be able to attend the conference this year, which is going to be in early May. One of the main ways that AHI works with clinical organizations is through our Adolescent Champion Model, which is what we are here to talk about today. The Adolescent Champion Model is an evidence-based intervention that we currently implement in 4 different states: Indiana, Georgia, Texas, and Arizona. We are partnering with our colleagues at Affirm to implement our model here in Arizona so that they can offer local expertise in providing care in Arizona and implement future cohorts with much less support from us. Throughout the course of this project, you will receive communications from both us at AHI and from Affirm as we all work together. Okay, so a little bit of background about the Adolescent Champion Model. Before we developed the Adolescent Champion Model, we talked to healthcare professionals in many different roles around the country to find out their pains and gains, what makes it hard for them to serve adolescent patients, and what makes it easy, and what do they enjoy. And some of the challenges that came out of these conversations will probably not surprise you at all. So some of the things that came up most from our interviews were it's hard to get adolescents in the door, and their visit times are limited. Health center environment is not focused on an adolescent population. Maybe it's more towards younger children or an older population. Providers and staffs are unfamiliar with confidentiality laws. Provider and staff are uncomfortable around adolescents and some of the behaviors that they show. And there are limited opportunities for professional development, especially for non-providers around adolescent development. All of these challenges add up to many kinds of missed opportunities for adolescent-centered care. So with these considerations, we created the Adolescent Champion Model, recognizing that the vast majority of young people do not receive their healthcare in adolescent-focused clinics. While adolescents are a vulnerable population with unique needs, any type of healthcare center should be able to meet these needs. So as we review the Champion Model, you'll see that we've tried to address all of those key challenges throughout the process. We created this model with input from many different disciplines, which you can see on this slide, including our youth council. We also followed national guidelines from the main medical societies, such as the United States Prevention Services Task Force and the Society for Adolescent Health and Medicine. And the model is driven by evidence and best practices.
Okay. So the ACM builds on the capacity of health centers to provide high quality youth-centered care with the goal of improving the healthcare experience for young people. The next several slides will highlight the steps of our dynamic partnership and also the steps to complete viewing of the session and also some steps for us to make sure that you all are ready and primed to participate in the model. The first step is to complete viewing of this webinar, 30-minute recorded overview, and also make sure that you all know our faces and names. The second step would be to form your champion team. So this would be any interested staff member in your health center that will commit to making the change within your health center. And typically what this looks like or consists of is an office or practice manager, a provider, and then 1 to 3 other staff members who will be key in facilitating the change. We then would encourage you to select what's called a champion lead. So this is someone on your champion team who will be the main point of contact between your team and a firm, and they'll also help to move the project along. The third step is then us offering support team office hours to you all. So following the full viewing of this webinar, if there are any questions or anything that needs to be addressed in terms of your participation in the model, we are offering office hours, 30-minute intervals for you all to meet with us and get those things addressed. We also encourage you, after this webinar, you'll receive a readiness assessment tool. We encourage you to review that with your entire champion team. And the champion lead is then asked to submit and sign that document and send it back over to the ACM support team. And we hope by viewing this webinar that you're considering joining a future cohort. We would love to have you. We're also always willing to work with folks to tailor the programming to your needs. Even though we want to maintain fidelity to the model, there are ways that we can work with your champion team. Okay, so now we'll go through what's called the ACM Readiness Assessment tool. It is a one-page document to help your team determine whether or not you're best fit to participate in an upcoming cohort of the ACM. This document goes over the program requirements by implementation phase, but also goes over what it looks like to be a champion team and what the time commitment is for such a commitment. And one of the things we want to highlight is that your team must be willing to commit at least 1 to 4 hours, a month as part of the champion team to move the process along and also make sure that you're managing program tasks.
I also just want to emphasize there, I'm sorry, that we're adaptable, and really what you'll find is that in terms of commitment, it's a little bit more time intensive on either end. When you're onboarding and gathering your surveys and your data, you'll see that, or towards the end, but really during implementation phase, many of our clinics really find it to be very manageable. And these steps that we've put here is sort of the sweet sauce, right? Having done this for 4 cohorts now, this is sort of guided by the recipe for success that we've sort of identified.
Thank you. So we're really trying to break the programming down in bite-sized pieces to make it feel as though it's obtainable, it's attainable, and that you know that we're here to support you throughout the entire process. At the bottom of the one-page document is our readiness agreement. And again, this is just so that we all understand the commitment. We all understand our partnership to each other and what our roles are as champion team and the ACM support team. And again, we're asking that the entire team review the assessment tool, and then the champion lead will then sign the agreement. So here you'll see on the graphic on the slide our different phases of recruitment. So this is sort of like our recruitment timeline, and we've just entered the recruitment phase of this document. But during the promotion phase, we announced news of our upcoming cohort. We produced a 1-minute teaser video that described the ACM in a very brief overview, and sent emails to health centers who've expressed interest. But as a more mature program, as Dr. Chulani said, we're in cohort 5 of programming now. Folks have really spread the word about the changes and transformations that they've been able to make within their health centers. So we've kind of transitioned to more of a word of mouth program. We're very proud of that. As part of recruitment, you all will see the steps on the slide again. These are what we'll do to make sure that, again, we're starting this partnership off with the understanding of what our agreements are and what our roles are. And so the asynchronous intro webinar is the first step, followed by the readiness assessment review, which will be included in a follow-up email from the ACM support team. And we'll also give you instructions on how to schedule those support team office hours with us. We ask that the readiness assessment be submitted by November 17th, because our team will meet the following week to select our 8 champion health centers. And we hope to announce that by Monday, November 27th. Onboarding is then to make sure that you all are primed for participation, that any outstanding concerns or questions that need to be addressed are handled during that 2-month period. I will also speak about marketing opportunities for you all to promote and share that you're a part of an upcoming cohort of the ACM and describe what the ACM is to other folks. So that is then followed by our implementation phase. So you'll see on this slide that we have a 3-month period in the beginning, followed by a 12-month period in the middle, and another 3-month period at the end. And our pre-implementation and post-implementation periods are when we ask the most of you in terms of data collection. So there are 3 data sets that we ask during this period, one of them being adolescent patient or youth surveys. And these look at aspects of patient satisfaction specific to adolescent concerns. So whether they're treated respectfully, whether the physical space is welcoming to teens, whether they have time alone and really feel like they have that space for confidentiality. These surveys are administered either through paper or electronically, and they'll be available in Spanish and English. And we ask that you collect at least 50 of these. This is followed by the staff and clinician surveys. So we'll need someone on your champion team to send us email addresses for each staff member and provider at your site that would interact with an adolescent. And they will get a private electronic survey sent to them that looks at 3 different domains of youth-friendly climate, knowledge and attitudes around minor consent laws, and clinicians will then answer a set of questions related to adolescent care. The third thing that we ask for is what's called the clinic information tool. And this is for us to assess practice type, location, insurance mix, your patient population information, and adolescent specific HEDIS measures. This tool can be completed by a clinic manager or anyone at your site who has the ability to run clinic-wide reports from your EHR. But we're also happy to talk through what that process looks like and how to pull that information. Another component of pre-implementation and post-implementation is our Adolescent-Centered Environment Assessment Process, or ASAP for short. The ASAP is a 12-area self-assessment that we'll facilitate with your champion team. So as we go through the assessment, you will identify priority areas for improvement, and we'll provide a customized implementation plan using a Plan, Do, Study, Act or PDSA process. Your champion team will just be asked to schedule a 2-hour time frame for us to go through that interdisciplinary assessment. Okay, and then in the implementation period, so that 12-month period, which starts in May, we usually kick this off with our full day in-person summits. And these provide basically a program overview. We do trainings. We offer time for sharing of challenges and strategies that you've implemented in your health centers. And we really just try to create opportunities for a community of practice. We will host Summit 1 on May 13th, and Summit 2 will be on November 18th, but all of that information will be forthcoming and be included on the ACM program calendar. Throughout the 12-month implementation period, there are also other monthly activities that we ask of you. One of them being under the check mark, there are check-in calls. So as the ACM support team, again, we're offering support to you throughout the 18-month process, but we do schedule 2 check-in calls with you to check in, share updates, share any bright spots and challenges that you're having as implementing the programming. We're really excited. We want to hear from you. And this is just our way to make sure that we're all holding ourselves accountable to talking through the process. The computer icon is then for our core content e-modules, and these are there are 3 core content modules that you'll complete as a champion team. So your entire team is encouraged to be present for this. They're interactive, self-directed, and intended to help you facilitate what's next to that, the star icon, our Spark trainings. And the core content modules are password protected. We'll make sure to always give you that password as part of the ACM program calendar and in our monthly updates. But the Spark trainings themselves are 6 prepackaged PowerPoints that come with scripts for you to facilitate for your entire staff. So the champion team can choose 1 person or 2 people to kind of co-lead the Spark trainings. But again, they are 15 minutes, they're prepackaged, and they're intended to spark conversation in your health center. In post-implementation, we ask all 3 of the same data sets that we ask in pre-implementation, but there is a new component, and it's the trophy icon and the blue wording at the bottom of the screen. And this is not required, but it's a perk of participation in the Adolescent Champion Model, and Dr. Shulani will talk about that in a little later.
Yeah.
Another essential document that we wanted to highlight is the ACM program calendar. You'll be getting this on a continuous basis. This is basically how you keep track of program implementation and what's required of all of us during our monthly activities. And so you'll see on the image on the left, you'll see the summits on there, you'll see check-in calls, you'll see the Spark trainings and core contents. And this calendar is interactive in that you can click right into it to get to the Spark and core content trainings.
Good. So at the end of your participation, so really think of it as you implement and you assess your, the outcomes of your participation and your change efforts. So at the end of this process, clinics have the opportunity to achieve certification as an adolescent-centered environment, depending on the number of best practices that were achieved. A big differentiator here between gold and silver and bronze is really the availability of after-hours appointments that perhaps can better serve young people who might have school and after-school commitments, and the availability of long-acting reversible contraception on the same day for young people seeking them. Those are the differentiating points. And like I shared, a good number of our centers really have achieved gold certification and have achieved even renewals of their certification as a result of their participation. Clinics, all practitioners, all that are part of the model, also have the opportunity to obtain maintenance of certification Part 4 credit for adolescent well visits and confidentiality, especially for us physicians who need to maintain MOC credits for board certification.
All right. And a new component that we're introducing this year is our Champion Chat monthly newsletter. This is our way of engaging with you all and sharing monthly activities, action items, anything that we have to share with you or that we may encourage you to share with us will be in this newsletter on the first of the month or on the first Monday of the month if the first falls on a weekend. So all news, resources, trainings, any pertinent information will be linked in this webinar. And this is also how we'll shout you out with all of those bright spots or highlights that you share with us throughout the implementation process. All right, so we so appreciate you tuning in to the webinar. We hope you're excited as we are to potentially partner with your health center and transforming your spaces into youth-centered environments. As a reminder, there will be a follow-up email that will be sent out, and it will include all the pertinent information that we've shared in the webinar, as well as some action items that we'll need from you. We invite you all to meet with your potential champion team and review that readiness assessment tool. We'll send a link to our office hours opportunities. They will be on Mondays and Wednesdays, starting on October 16th and will end November 13th as our encouragement of that submission of the readiness assessment tool by November 17th. The assessment document will be the main component of selection in the cohort. So we do ask that you all meet, review that, and have any questions or concerns addressed before that November 17th deadline. We will announce Cohort 5 Champion Centers on November 27th, and Cohort 5 will then begin on February 1st of 2024. Any questions in the meantime can be directed to our new email address, acm@affirmaz.org, and we'll try to get to your message or respond within 2 to 3 business days. Thanks so much for your time and consideration.
Thank you.